Hello everyone. In this video, I will be talking about an antibiotic medication, ZYVOX Linezolid, which was initially approved by the US FDA in 2000. ZYVOX is currently indicated for the treatment for bacterial infections caused by susceptible gram-positive pathogens. Now, let's dive into this medication in more detail. Linezolid, brand name ZYVOX. This medication was initially approved by the US FDA on April 18, 2000, and currently indicated for the treatment for nosocomial pneumonia, community-acquired pneumonia (CAP), complicated skin and skin structure infections (CSSSI), including diabetic foot infections, without concomitant osteomyelitis, uncomplicated SSSI, vancomycin-resistant enterococcus faecium (VRE) infections caused by susceptible gram-positive pathogens such as methicillin-resistant Staphylococcus aureus (MRSA), Streptococcus pneumonia, Streptococcus pyogenes, Streptococcus aegalea, and Enterococcus faecium. Chemically, linezolid is a synthetic small molecule containing the oxazolidinone, so that's the motif in the middle, along with the 5S stereochemistry, acetamide and morphine motif, so which is highlighted in pink and also in blue. Molecular weight 337.35 gram per mole. Hydrogen bond acceptor 7. Hydrogen bond acceptor refers to the number of nitrogen and oxygen within the drug molecule. Hydrogen bond donor 1. Hydrogen bond donor refers to the number of OH and AH groups within the drug molecule. Log P 0.3, which is a lipophilicity parameter. The higher log P, the more lipophilic a drug molecule. Polar surface area 71 square angstrom. This medication is available as 200 mg per 100 ml and 600 mg per 300 ml, which is 2 mg per ml for intravenous use, 600 mg as tablets, and 100 mg of linezolid per each 5 ml for oral suspension. Recommended dosage for adults and adolescents 12 years and older, 400 mg or 600 mg intravenous RV or oral every 12 hours for 10 to 14 days, except for VRE, which is for 14 to 28 days. For pediatric patients birth through 11 years of age, it's weight-based dosing, 10 mg per kilogram, every 8 hours or every 12 hours. For specific indication and dosing, see full prescribing information for details. Mechanistically, this medication works as a protein synthesis inhibitor by binding to 23S ribosomal RNA portion of the bacterial 50S ribosome subunit, preventing the formation of a functional 70S initiation complex, which is required for bacterial reproduction. Pharmacokinetically, Tmax, the median time to reach the maximum plasma concentration, is approximately 1 to 2 hours, and the absolute bioavailability is about 100%. Further, giving this medication is available for both RV infusion and oral dosing, and its excellent oral bioavailability. No dose adjustments are needed when switching from intravenous to oral dosing. Protein binding is approximately 31%. The volume of distribution of linezolid at steady state ranges from 40 to 50 liters, indicating that it readily distributes to well-perfused tissues. The half-life from adult subjects is approximately 4.9 hours. Metabolism. Linezolid is primarily metabolized by the morpholin oxidation, producing two inactive ring-opened metabolites. Excretion. In the urine, about 30% as unchanged parent drug molecule and 50% as metabolites. In the feces, about 9% as metabolites. Drug-drug interactions. Monoamine oxidase inhibitors, MAOI, and potential interactions with adrenergic and serotonergic agents. The reason is that linezolid is a reversible, non-selective monoamine oxidase inhibitor, which may interact with adrenergic and serotonergic agents, including antidepressants and opioids. This can further increase the risk of elevation of blood pressure, as well as serotonin syndrome. Contraindications: non-hypersensitivity to linezolid or any other product components. Patients taking any MAOI or within 2 weeks of taking a MAOI. The most common adverse reactions, greater than 5%, associated with ZYVOX include diarrhea, vomiting, headache, nausea, anemia. Here is the key source which I have used to prepare for today's video. Most of the medication information which I share today is based on ZYVOX prescribing information. This document is available at the US FDA drug website, along with the drug manufacturer website. Finally, I want to thank you so much for watching. If you found this video helpful, subscribe for future medication video updates. As always, keep learning and elevating. Thank you so much.